brain is the most important and complex organ of the human body. It's the main driver of both conscious and unconscious actions of our organism. Our ability to move, speak, and think depends on it. Such unconscious functions as swallowing and breathing are also controlled by the brain. When such a complex mechanism breaks down, a person is no longer able to perform actions that once seemed to be so simple.
Indeed, the brain diseases significantly complicate a human life. And here, in the Center of the Brain Research and Neurotechnologies of the FMBA of Russia, the leading doctors and scientists study and treat the brain disorders, restoring the freedom that illness has taken away. Before starting treatment, it is necessary to understand what needs to be treated. And, just as importantly, where the pathological formation or pathological process is located. For this purpose, our center has a full range of research equipment such as a hybrid, single-photon emission computed tomography, or PET MRI, which is a hybrid method that combines MRI and PET element, where the radioactive label is used. It gives the opportunity for clinical physicians to start treatment at the early stage and to choose the most appropriate treatment tactics for a particular disease.
How can brain disorders manifest themselves? In Parkinson's disease, a patient loses control over his movements. He gets pronounced tremor, stiffness in movements, making it difficult to hold a cup, write, walk, and maintain coordination. And although we cannot cure this disease yet, we can manage it. Alleviate the symptoms of this disease, including through focused ultrasound, which can significantly reduce tremor severity, restoring freedom of movement.
Focused ultrasound is a technique based on the impact of high-intensity ultrasound impact on the deep brain structures, which ultimately leads to destruction of pathological lesions smaller than 1 millimeter. With focused ultrasound, no anesthesia is required. The patient remains conscious, and we can observe the therapeutic effect immediately after the surgery. Currently, surgical approaches and techniques are selected to avoid disabling the patient. When a stroke, one of the most severe vascular diseases of the brain, occurs, it is extremely important to act quickly. It is crucial that the patient gets to the hospital within the first 4 hours. And when patient gets into clinic, he is being sent to endovascular operating room. Through only one puncture, in a matter of seconds, we can get an access to brain vessels. We will see the thrombus that caused the stroke and remove it, restoring blood flow to the ischemic areas of the brain. In addition, the other vascular diseases, such as aneurysms, arteriovenous malformations, dural fistulas, various brain tumors, can be treated by endovascular method. Endovascular technology returns to patients the freedom to live the life that they want to live.
And what if the brain has lost some of its functions? In this case, a patient is referred to medical rehabilitation. After all, the brain is a complex factory where many highly skilled specialists work. Each of them has their own function. If one stops working, other must take over his responsibilities. Restoring lost functions after brain damage is a complex and research-intensive process. For example, psychologists and neuropsychologists work on restoring higher mental functions. Speech therapists restore swallowing, speech, and voice functions. In our institute, we develop modern technologies such as NeuroChat, enabling to initiate pronunciation of single words and sounds in patients who have completely lost the ability to speak. Physical therapists work on restoring movement abilities in different body positions, whereas high-tech devices with biofeedback and virtual reality assist in maintaining an upright posture. Devices using robotic technologies help restore arm function. They send signals to the brain indicating that the arm is still functional and can be used. Occupational therapists deal with regaining the ability to use the remaining movements. Once individual specialists have completed their work, the so-called sensory-motor integration begins. Mental and motor functions are combined into complex coordinated movements. For this, immersive virtual reality systems are used. By integrating impaired and preserved functions, we restore a person's ability to move and communicate. But not everything can be restored. What if the changes are irreversible? What should be done in this case?
Indeed, in some cases, the changes are irreversible. In certain diseases or brain injuries, neurons die and their function needs to be restored. We can take a patient's skin cell, reprogram them, and grow new neurons. These neurons are then transplanted into the damaged brain to restore lost functions. In a certain sense, it is a kind of a little miracle, because it is known that neurons do not regenerate. The neurons are given us once for life. In this way, we can, in a sense, trick nature by creating new neurons, even in an adult, and place them back to the injured brain.
I was also told that after a stroke, a person may lose control of an arm. But what if their arm is no longer there?
Yes, in such cases, patients receive prosthetics, and some of them are already bionic, enabling them to perform everyday tasks like picking up and carrying objects and performing some actions by using them. But in the nearest future, they will feel this prosthetic as their own arm. This arm will become an integral part of the nervous system. Such technologies will be developed more and more.
Yes, it all sounds like fantastic, and all this progress in just 5 years. I can even imagine what will happen next. Does it mean that brain diseases will no longer be a threat to us in the future?
Many of them are still not well understood, and there is much work to be done. But we look to the future with optimism.